Hey everybody. Uh, Wanted to speak with you for a moment here and congratulate you for the fact that we have been able to keep this place essentially COVID free for the so many months that we've been dealing with this situation, and that is really quite an achievement. Um, and I would say there's an old adage that an ounce of prevention is worth a pound of cure. And that's exactly what I would say applies to what we're trying to achieve here. If we take little steps to try and keep this place clear of this virus, it saves so much effort that would be involved with trying to clear out and to cure this facility if COVID came into these walls. So I want to congratulate you and thank you really for doing what we need to do in order to try and keep this place the way it is, which is COVID free. Now, what is that? What is doing what you've done? Well, you've been wearing your masks. Sometimes you need to be prompted that you need to put them on. I get that. But you have been using them. I would encourage you to use them more throughout the day because it only takes one situation where you come across the wrong person or the wrong situation, and suddenly we've got a problem that spreads through the facilities very, very quickly. So let me. I always thought that this looked kind of like a little Christmas ball or something like that, but it's actually quite deadly. Um, but that's COVID, and I want to just talk briefly about what is involved with COVID and why we're concerned with it. Well, this is essentially like the Trojan horse. I don't know if you know this story, but it's how the Greeks defeated the Trojans. They couldn't get through their walls of Troy, and eventually they snuck in this horse that the Trojans felt was a present. Essentially, they let their guard down, pulled this horse into their walls, and then in the evening, when the lights were out, the soldiers who were hidden within the horse snuck out and then essentially went and marauded the entire town and took over Troy. So that's the concern that we have, is that we're going to drop our or let down our guard, and in doing so, we're going to somehow let this sneak in when we're not expecting it. That's the way this virus works. That's the way it gets what it's after, which is exposure to other humans, and that's what we need to guard against by using masks and social distancing in the proper manner. We have developed, and you can't see this very well, I see, but we have developed guidelines, or actually in this case it's a policy, that goes over the way that we're trying to deal with this problem, and this policy has been very effective so far, as I've said. And for us, much of the last 4 or 5 months have been, I'm sorry, the 4 or 5 weeks, we've been in phase red of this policy. And what phase red means is that we have a situation where we have a certain number of cases in our area per 100,000, and what they call an 8% positivity rate. And these are not things I'm going to go into, but it basically says that we're at the highest level of infectivity than the scale goes. And what we have determined is that when this gets to this point, we follow these rules, and you know these rules, that we've gone to telemedicine so that we don't have as much exposure from person to person. We screen people as they enter the building with checking their temperatures and making sure they don't have symptoms that might be consistent with somebody with COVID. We quarantine when we need to, and we do use social distancing, and that in particular has been a problem recently because there's been some lapses in what we've been doing with the social distancing that have led to some problems, and we've had to do some quarantining as a result of that while we've gotten people tested. We've also gone to using extensive testing in order to protect people as they are admitted to our facility. In doing that, we protect everybody within the facility. And we've changed the way that we do things in order to decrease exposure to other individuals. Our urine drug screens are done less frequently in the outpatient basis. That's not great for what we're trying to achieve with the substance use issue, but for right now it needs to be the way it is in order for us to stay safe from this virus. And we've also changed the way that we do our staffing so that many are working from home when they can, and we try and keep the high-risk individuals home as well. So these rules that we've come up with have come from a number of different sources. This one in particular we found was very helpful. It's put together by the National Council for Behavioral Health. And this booklet, really goes through every little possible scenario that we might encounter with this virus, and gives us some guidance about what we can do to try and manage each of those scenarios. And that we've boiled down into what we now have just reviewed as the policy that we have in our facility. But I want you to know that the policy that we have has been generated as a result of a good bit of research that has been done in regard to the virus and how it relates to long-term facilities where people stay, and how do we keep that facility safe so that the people within the facility can be safe. Every encounter that we have with a concern, we have some idea about how to deal with it because we've done this research. And it's important to me that we make it clear to you that there's been a lot of discussion and a lot of thought that's gone into each of these episodes that have been threatening in some way. And as a result of that, we've come out on top, and we still have a clean facility that is COVID-free. So that's what I wanted to say. Again, I want to thank you, and I want to encourage you to continue to try and not only police yourself with using the mask and using behaviors that are going to be more conducive to keeping things the way they are, but I also want you to feel free and feel I don't want you to have concerns about just reminding somebody else, hey, your mask is not on, because sometimes people forget, especially after eating or something like that. It's very easy to just forget that your mask is not on. It's not something we've been living with our entire lives until the last year. Please do that, and I hope that the person that you're reminding will be thankful for the fact you've done it. Anyway, thank you very much, and good luck with everything going forward.